Kinsa is a smart thermometer company that tracks people's fevers in real time, and its data can show where the coronavirus is spreading. Here's a chart we have of their data out of Florida, for instance, which shows a spike in fevers rising in early June. And today, we are seeing that come to pass with Florida's growing COVID caseload. Joining us now to discuss where the next hotspots could emerge is Kinsa's founder and CEO, Inder Singh. Inder, a lot to talk about. Thank you for joining us. Where do you see this spreading next?
I'm concerned about 4 states right now. I'm concerned about Oklahoma, Missouri, Louisiana, and Maine. We've seen higher than expected transmission levels. One of the things we can see besides fever is how fast an illness is spreading in a local area. And we've been seeing higher than expected transmission levels in those 4 states.
So tell us exactly how the analysis works and how you track it.
So we make these. These are smart thermometers. They connect into an app that provides guidance to an individual on where and when and how to get care and how to respond to your illness. And we now have about 1.5 million of those across the country. And so we get to see aggregated information on where and when symptoms, fever and other symptoms, are starting and spreading. Because fever is an early indicator of COVID and many infectious illnesses, we get to see that before the healthcare system sees it. We talk to people when they're in the home before they ever enter the healthcare system. And we're also able to see how fast that's spreading in a particular geography or even within a household. And that's highly predictive of how fast an illness is going to spread in the broader community. So with that information on where and when it's starting and how fast it's spreading, it gives us an advantage to see where COVID outbreaks are going to occur.
How effective, Inder, do you think it is for companies, as they're bringing back workers, to have temperature checks, doctors' offices to have temperature checks? Because obviously, as you're pointing out, on one hand, it's great indication, catch a few cases, isolate them. But on the other, it doesn't pick up pre-symptomatic, doesn't pick up asymptomatic. So, you know, there are questions about whether it's a false sense of comfort.
Yeah, and there's 2 different kinds of temperature monitoring we're talking about here. One is the lobby, the high throughput temperature screening in the lobby. And there's a lot of studies out there that are showing that that's not very effective in and of itself. It's not effective by itself. It could be effective with other tools, partly because it's hard to get a good temperature reading in those high throughput screening, and partly because by the time someone gets in the lobby, it's too late. They've already spread the illness. So what we're trying to do is create an early warning system, not only for states and our healthcare system, but also for employers, where you can see illness spreading in your community of employees and the households of the employees, all aggregated, all anonymized, so no one's information no one's personal information is of concern, but you get to see if there's an outbreak in your community. And that kind of early warning system is something that we've never had in this country. It's something that the world's never had. So, how do you stop an outbreak before it becomes an epidemic if you don't know where and when it's starting? And the answer is you don't. We need to be using 21st century technology like Kinsa's and others to do early warning so we can contain an outbreak when it's small before it spreads. And that's the whole point of a system and network like ours.
Well, on that note, Inder, how optimistic are you that long term we will learn from this pandemic, in particular be ready to catch the next one early? I mean, on this show, we're always talking about trying to predict the next stock market downturn and how hard that is because it'll be a different trigger next time round. Does that apply to this, or can we learn from our mistakes and never have to experience the type of scenario we have over the last couple of months again?
I'm glad you asked that. I hope this just goes away and that it prepares us for the next one, right? But the United States has been spared largely over the last 20 years from significant epidemics and pandemics. We were not significantly affected by 2003 SARS, nor 2009 swine flu, nor Zika. And now we're talking about COVID. Other countries were, and they were a little bit more prepared. So my hope is that this all goes away and it gives us a reprieve so that next time we can stand the systems up and next time we're ready. That's my hope.
Just want to bring in some breaking news that's related to the conversation, and it comes from California. So California is now mandating people must wear masks indoors. The order comes from Governor Newsom. He says Californians we're just seeing too many examples of them not wearing masks. And so now the order states that if you're inside, in line to enter any indoor public space, if you are obtaining services from the healthcare sector in settings, including to but not limited to a hospital, pharmacy, medical clinic, laboratory, physician, or dental office, you have to wear a mask. Inder, has your data showed anything about the effectiveness of masks and the pervasiveness of people using them?
We're still looking at the data to see if those this is like a natural experiment that a scientist would look at. In those locations where there are masks, are we seeing as rapid increases in illness accounts? Again, the places that we're currently concerned about are Oklahoma, Missouri, Louisiana, and Maine. But I will get back to you with more research on that particular question. I will tell you that I believe that that's going to be true. You're just going to see less transmission in those areas where a large percentage of the population has masks. It's intuitive. It makes sense.